Good morning. Hi, Thanos. How are you today?
Fine. Good morning, Angie. Thank you for having me.
Thank you for joining us. Today, we are going to ask you a few questions about VR simulation for medical training. You are a consultant in general and digestive surgery at Levanger Hospital. Before we start, can you tell us how you became involved in VR?
Yes. As you said, I work as a surgeon daily at our hospital in Levanger, Norway. I have also a position as an associate professor at the Norwegian University of Science and Technology, the NTNU, and I'm teaching and tutoring third and fifth year medical students as well as PhD student. So it's my first serious encounter with VR technology came a couple of years ago, or after the COVID crisis, at a course for educators, which was organized by the NTNU, focusing on teaching in immersive environments. So it sounded fun. And although I was exposed to VR within the course, it was very brief. It was a very powerful experience. I got the so-called wow factor. Um, and afterwards, we had to write an essay on how we could use this technology in our teaching setting. So I had to read a lot about articles about the pedagogical principle of VR-based simulation and education. I heard a lot of podcasts, but it was not enough. And it was not until I bought my own headset, a MetaQuest 2, when I began to understand the power of this new
Okay.
technology.
Okay, fabulous. So mannequin-based simulation is currently the gold standard for clinical training, but VR is emerging as a new way of training that requires less infrastructure and allows greater accessibility and flexibility. How do you think VR can be integrated into the medical curriculum in hospitals?
Well, as you said, mannequin-based simulation or simulation using human markers has been the gold standard over a long time, indeed, and has been used both for training of medical and nursing students, as incorporated in the curriculum, as well as in continuous training and drilling of medical and nursing personnel at the hospital. The big challenge is the need for use of extensive resources. Uh, that means facilitators, markers, mannequins, probably having a known simulation lab, or the latter is not an option for small and medium-sized hospitals because they, uh, as a rule, they do not have the budget or the area to have and support such a simulation lab. So anything such costs a lot of money to both to run and maintain. So this necessitates the use of parts of a hospital to run the simulation sessions. And although we at our hospital try to have many simulation sessions throughout the year, both everything from medical cases, trauma cases, pediatric and gynecological cases, well, there is a limit on how many sessions we can actually run without affecting the everyday logistics of the hospital, and consequently how many people or personnel we manage to get through such simulation training throughout the year.
Mm-hmm,
So the VR simulation can bypass this limitation. It's easier to arrange it. We do not need to be so strict with a timetable. We can arrange it later on the day. We just need a few headsets to run it and a solid VR platform without the need of having extra resources, extra uh, areas, mannequins, or expensive simulation labs.
Okay, you are actually talking a lot about the benefit of VR simulation versus a traditional conventional simulation center. But I'm sure there are some limitations with VR, the technology for medical simulation. Could you tell us a little bit about that?
Well, there are some limitations one must keep in mind. Must keep this in mind when introducing others to this technology. So everyone must have the same degree of expectations. I could say that it still lacks some realism. It is kind of computer graphics, very good, but still computer graphics. But on the other hand, this is not necessarily a minus. There are VR experts out there claiming that increased levels of realism actually can be overwhelming for the users, distracting them from the task they are supposed to be training in. So as long as the users feel that the training setting is genuine and, let's say, real, VR will be serving its purpose. The hardware has been better, cheaper, more accessible. So this is not a big problem. Some years ago was probably science fiction and very expensive one. If I would pinpoint something for the time being is the lack of realistic tactile feedback, especially when it comes to procedural training. But there is a big focus on that topic, and I'm quite confident that a solution will appear in the coming years.
So now, if a hospital would like to implement VR simulation for their training, what are some of the things that they should consider?
The main aspect is to for the hospital to decide what they want to use VR simulation for. This is quite critical in order to choose the right platform. There is, as I said, there are platforms focusing on critical clinical thinking, which is very important for younger doctors and nurses and students. But there is also the aspect of ongoing team simulation, which is very important for, let's say, the adults at the hospital as well, those who have been working at the hospital for some time and they need to train in a regular basis. And we have also some platforms providing procedural training, building up muscle memory. Probably a good step for younger doctors earlier in their career before being allowed to do procedures on living. It's very important to have the technical aspects on the first place. I mean that the internet connections are solid, the headsets are up to date and functioning, because you are going to get a demotivated group of people if these things are not function as they should. And of course you have to choose a very solid VR platform providers who can deliver a solid solution working under any circumstances. I think that SkillUp has developed a very good solution for trauma training, and it's something that that medium-sized and small hospitals train a lot, but we do not have the opportunity to train as much as we want because of the limitations we talked about before. We tried it at our two hospitals, Levanger and Namsos. It was very interesting to see people who hadn't used VR technology before to get engaged, and it was they experienced the whole simulation training as very genuine, very light, very similar to what we're doing in the actual traditional physical training, or when we get real trauma patients. They were really good in adapting the technology. It worked pretty much intuitive. So I think hospitals in general can use this kind of simulation to increase the volume of training when the areas and the logistics of the hospital do not allow for traditional simulation.